Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello, welcome to Dr. Jeff Talks About Sex and Intimacy, and thank you for joining us for another meaningful conversation about sex, intimacy, and relationships. No matter where you are in your journey, this is a space for learning, for connection, healing, and most of all, for hope. This is episode 74. Not in the mood? Let's talk about low desire. It's going to be a great episode. So whether you're watching live or if you're listening to the recording later, every moment of your amazing life matters. And I am so grateful that you took time out of your life to learn and be with us. So thank you. We are connected across all the different platforms. We're on Facebook, we're on YouTube, we're on X, we're on LinkedIn. If you are a Facebook person, quick favor, follow us. The more people that follow us, the more we can do on Facebook. And thank you, whatever platform you're on, for watching. Visit the website. When you go on the website, you can watch all 73 previous episodes. You can pull up the calendar and see all of our programming that goes all the way through. We have stuff through September already in there. So look at all the wonderful guests, watch all the previous episodes. You can find that all on the website. You can take us with you. We are streaming. We are on iHeartRadio, we're on Spotify, we're on Amazon Radio. When you're working out, take Dr. Jeff with you as you're working out. Learn more about sex and intimacy. On the road with your lover, you can have a wonderful time learning more about sex and intimacy when you take us with you and stream with us on audio. As always, I'd like to remind everyone that all are welcome here. Whatever your sexual orientation, whatever your gender identity, whatever your relationship style, this space was created for you. And please know you are so welcome here. The mission of the podcast is super easy. It is to empower and enlighten you with the scientific evidence-based information that improves your sexual health, that deepens your loving relationships, so you can live this unique, miraculous life wholeheartedly and fully and with more love. Tonight's episode invites us into a compassionate and honest discussion about low desire. Why would we talk about that? Low desire, doesn't everybody have desire? Not necessarily. And one of the most common yet least talked about experiences affecting couples today is low sexual desire. So we're diving into this most common and often misunderstood sexual concern affecting both men and women. Desire can certainly change throughout our lives and relationships for many reasons, including stress, health concerns, medications, hormones, relationship dynamics, trauma, aging, parenting, body image, and emotional connection. So many things. Yet, despite how common it is, many people struggle to talk about it openly with their partners even, without feelings of feeling ashamed or rejected or frustrated or feeling inadequate. So we're going to be talking about it today for sure. I'm honored to be joined by one of the leading experts in sexual medicine and women's health, Dr. Susan Kellogg-Spadt. She's been with us before, and we love her here on Dr. Jeff Talks About Sex and Intimacy. She's an internationally recognized expert in sexual medicine and in women's health. She is the director of female sexual medicine at the Pelvic and Sexual Health Institute of Philadelphia, Philly, and she has dedicated her career, I can tell you for sure, she's dedicated her career to education, research, and compassionate care in sexual health. Dr. Kellogg-Spadt is certified, just as I am, as a sexuality counselor, and as well, she is an educator. She is a frequent national and international speaker, and she's a respected author, researcher, and clinician. And honestly, she's a dear colleague of mine. I can't think of anyone better to talk about this subject of low desire than with you, Dr. Kellogg-Spadt. Welcome, Susan.
Oh, I'm so excited to be here. And I can't think of anybody I'd rather talk about this with than you, Dr. Jeff. So,
Great, great. Very good. And so we're going to dive into this fun topic. So, why would we even talk about this? What do you think the number one sexual complaint of men and women, if we pool them together, what's the number one complaint? Is it orgasm disorders? Is it is it arousal disorders like erectile dysfunction
or
and
pain disorders. Well, the truth is, this is it, Jeff. We're here. Number one, the whole world
absence?
wants more desire. The whole world wants more desire,
The whole
for
world
sure.
wants more desire. So
Yeah.
So what does the research say? And the research says that about 30 to 40% of women report concerns about low libido, and about 15 to 25% of men report low libido. And that's mostly in the middle age group between like 18 and 59. These studies first, there was this incredible landmark study, and I know you're so aware of it like I am, that we'll probably never do again, by Ed Lauman. I actually took a class with him at University of Chicago. Really cool guy. But in 1999, they did this landmark study. Why? Because they needed to figure out what was going on with sex because of HIV and things like that. So they actually got that study funded, and they found out so many things. So that is one of the first studies that showed us this is the most common thing. But then afterwards, like Chevron in 2008, 2009, with women, found 27 to 52% of women, depending on their menopausal status, reported low sexual desire. Gosh, that could be half of the women out there, depending on where they are in their menopausal status. That's a whole lot of women.
It's absolutely true. But that's bad news and it's good news, because it's bad news because the numbers are so high, but it's good news so that our listeners don't feel alone, because this is so, so, so common among men and women too. And that's a big news flash, is that men can have low desire too.
Totally. So then what about recent studies? Well, this is a recent Italian study from 2024 with almost 1,600 men. 32% had previously unrecognized low sexual desire or interest. So again, we're seeing these numbers. So if you have low sexual desire, you're like, gosh, all my friends talk about all this stuff. It's so great. And I just don't feel that way. You're not alone. Whether you're a male or female, you're
Absolutely.
not alone.
Absolutely. Positively. But you
So,
know what? I was just thinking, like, there's so many reasons for low desire. It's so common. There have to be a gazillion reasons, right?
mm-hmm, mm-hmm.
So, I mean, I'll just kick this off if you don't mind, because one of the things I see all the time is our lifestyles. We're so busy, 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 working, going to kids' games, doing podcasts all evening. I mean, it's like everybody's so busy all the time that we don't slow down. We slow down sometimes to binge Netflix, but we don't slow down sometimes to binge each other, to be really quiet and mindful and really work on our desire the way we work on other things. Oh, mind you, I'll be at the gym working on my body, but what am I doing to work on my desire? It's one thing I ask patients all the time, and they kind of come up with a blank, like, oh, well, that's your job, Dr. Kellogg. You're supposed to give me drugs to help me with my desire. So I don't know. What's your experience, Jeff?
Oh, same thing. And if you think about it, the physiologic things that affect desire, certainly aging, of course, can affect desire, but
Mm-hmm.
more commonly, all the illnesses that come with aging, diabetes, all kinds of different things, hormonal shifts, depression. Think about just after COVID, all the people with depression, anxiety before too. So many comorbid physical conditions, but also relational difficulties. When you're not getting along, sometimes you're like, I don't have a desire because I don't really like you right now. So
Absolutely.
I see all that. Medications can affect it. Stress. Think about the stress. Remember, I'm going to date myself, but I think you remember this. Remember the old commercial, I can bring home the bacon, fry it up in a pan, about
Yeah,
how a woman can do everything. She can work, she can raise the kids, she can keep the house, she can cook the dinner. Really? Who has anything left at the end of the day for sex?
absolutely. Absolutely. And I think the other thing is that people can get kind of hung up on this because they expect that desire rush, like you got when you first met your partner, or when you meet a new partner. If you're out there dating right now, when you meet a new partner, all of a sudden it's like, surprise, my desire is back. And that's because there's hormones in the brain and neurotransmitters in the brain that help to steer us in that direction. And if you are not new in a relationship, and or you're not feeding your mind, like we'll talk about in a little while, with things that increase those neurotransmitters, then life is kind of doing this flat line. It's not so exciting. But that doesn't mean that people can't try. And actually, I hate to say this word, it's overused, but fake it until you make it. So they can make the overture to be sexually active without truly like salivating for it. You don't have to be wild with desire to have a meaningful relationship. Would you agree with me?
Oh, absolutely. And those neurotransmitters are such a big deal, dopamine and different things, that when you meet somebody new and you're so excited, it's also increased with hugging for like 15 to 20 seconds or longer, or eye gazing. But if you're not in a brand new relationship and in that whole everything's so new, not so much are those neurotransmitters in your brain activated. So, but there are things that will activate them, and we'll talk more about that later. But, and two, when you've been in a relationship, like when you first start, you're like, where do we start? How do we start? It's all that, right? But
Mm-hmm.
I've been married 40 years. I know you've been married a very long time
I've
as
been
well.
married 40 years as well. So, yeah.
That's crazy. So we've done a couple episodes on keeping desire and love alive, of course, but ultimately, yes, it's different. Things are different. And we have so many things in our lives. I think that you hit on that is so key, that sometimes you're just like, okay, what do I have energy left for? And I mean, sex is a big deal. We're very pro-sexual people, Dr. Kellogg and I, because
Yeah.
obviously we've dedicated our life to it. We think it's very important. But in my life, to be totally honest, of course, it's hard to fit all these things in. And if
Excuse the pun, but yes.
Absolutely. And if we don't make it an intention and a priority, it can slip. It can
Yeah.
definitely slip. So how often in the research do men and women have sex average age 18 to 59? This is from the Lauman study, 1 to 2 times a week average.
Mm-hmm.
So if you're thinking, oh my God, shouldn't we be having sex like every day or 4 times? A small percentage, less than 10% of people have sex 4 times or more times a week. So if you're one of them, awesome. If you're not, there's nothing wrong with you. It's okay.
The
Um,
flip side of that is that 10% of all couples, whether they're married or not, have sex less than 10 times a year. A year. So somewhere in the middle usually is where we all fit, where our patients fit, where we fit. So I think it's important not to hold ourselves against a standard of 1 to 2 times a week or 10 times a year. It's anywhere in the middle. It's where you feel comfortable. What I think is, when people feel low desire and they come and see us as healthcare providers, they do so because they feel distress. They
mm,
feel an incredible sense of distress, that something's not right. They're fighting more. They don't feel as close to their partner. Or some people come because they feel like they're outside the norm. And so the first thing that I'm really glad we did is we just set out that giant, fishbowl of what is normal for sex.
yeah. And too, you brought up a really important thing. The most common reason for couples seeking sex therapy or relationship counseling is a mismatch in desire, a
Mhm.
discrepancy in desire. One has
Yep.
a strong desire, the other. So desire issues are what they are, things that often people are suffering with. It's not always what brings people in, because like in my clinic, which is
Mhm.
mostly male dominated, but I do see men and women both. Men come in most commonly by a landslide for erectile dysfunction. And I'm guessing in your clinic, it's not the number one thing that brings people in. Why do you think that is, listeners? Because sometimes when you have a lack of desire, you're not motivated to go see anybody about it, because you're like, it doesn't necessarily distress you. It might distress your partner. So now when we add distress in, that's when people come to see me and come to see Dr. Kellogg. But without the distress, that's why, even though so many people are suffering with desire disorders, like you may be, or struggling with it, they're not distressed by it. So maybe they're not struggling so much. But still, it's a part of the human journey. And maybe they're not struggling because they think, well, and if you're okay with it and your partner's okay with it, that's beautiful. And everyone is okay with it. But I think sometimes people think, well, there's nothing I can do about it anyway, is
Mhm.
the other piece of it,
Yep,
right?
absolutely, absolutely. And there's so much that you can do about it. So I'm ready to dive in if you are to
And
talk
in
about that.
speaking of that, don't hold your standards to what you see in movies or what you see
Yeah,
on
absolutely.
TV. Think about it. How long does it take you to reach your climax with a partner? When you watch TV and watch people from when they push each other up against the wall and it all starts, how many does it even take a minute sometimes?
No, it's seconds. It's absolutely seconds. No question.
It's not
No question.
real. It's not real, guys. It's not real. So just know that that's not real. But that's one thing. I think it's funny because we sometimes erotica, especially this is a real term, listeners, bibliotherapy, which means
Hmm.
reading sexual content to help you become more engaged with desire and stuff. There's so many different things you can do, but that's one that pops in my mind that I like actually a little better than necessarily the visual erotica because and the reason I say that, the only reason, I have nothing against any of that. I think it's great. But then sometimes we feel like we're comparing ourselves to those people in the movies, whereas you're making up the people in your head when you're reading it. So I
Yeah.
like reading better than some of the for clients than some of the visuals because I find partners. I don't know. Do you see this? Partners will say, "I don't want to be held to the standard of." He was really well endowed. Everybody in those movies is well endowed. Why would
Yeah,
they
they
be?
are. That's come they got the job actually. So
She's beautiful and
yeah,
has a
yeah,
perfect body and blah blah blah.
yeah.
That's
Mhm.
why they got those jobs. They're not going to
Yep.
put, unless you watch a very specific type of erotica or porn, you're not going to see typical people or people who don't have what some people view as a perfect body. So we don't have to be held to those standards with bibliotherapy or reading erotica, but there's so many great things. What other things that you think can be really helpful?
Well, I think people can listen to erotica, which is like the cross between using visual porn and reading. Is that you've got a headset on, and maybe you're doing a podcast, or you're hearing a erotic story, but you can't see the players. You can hear the moaning, and you can hear the seduction, which is very hot, but you can't see the players. And so our point, I think, for both of us is that if watching porn doesn't do it for both partners or all 10 partners, who however you're making love, then you have to be a little bit creative in terms of see what really turns you on. And sometimes one person in a partnership will love visual porn and another person finds it upsetting and distressing. And so to work with one another to work on that is really great. Other things that really help desire, I can speak. I am a specialist in women's sexual medicine, and I see far more women than men. And women tend to, speaking of the GLP-1s, when they lose weight and when they feel like they look good and smell good, and they tend to have more desire. And so it doesn't just mean losing weight. It means in the broader spectrum, taking care of your body, having enough water to drink, having enough good nutrition in your body, and then feeling strong, not necessarily slim, but strong in their bodies. Women
Mhm.
tend to feel much more likely to engage in sexual play because they feel good about themselves. What do men do the same?
Totally. And I even have men say, when, because I always am pushing, of course, the workout because it helps with things like blood flow to the penis with erectile
Hmm.
dysfunction, but it helps with testosterone. It helps with so many things sexually. We've talked countless times on the show about how important exercise is to men's sexual health. But also, men just tell me, I feel more desire when I'm working out regularly and when I'm
Yeah.
doing things like that. And again, I think sometimes it helps you feel better about your body and all those kinds of things. So I agree wholeheartedly. I hear just as much as that from the men as you do the women, for sure.
So now let's talk about another healthful behavior, and that's sleep. I can't tell you how many times I hear, well, Dr. Kellogg, it's 11:35 at night and sex is competing with sleep, and I really want that sleep. So I go for that sleep. So sometimes It's timing of sex. What do you think, Jeff?
Oh gosh. And you know what? This is so funny. And this really gets into how we're programmed by society.
Yeah.
I have to break people out of their thinking of we only have sex when we go to bed at night. And I'm like, I'm exhausted. The minute my head hits the pillow, I'm like, why do you only have sex when you get in bed to go to sleep? And they're like, what do you mean? I'm like, how about in the morning? You get out of the shower, everybody's clean, or in the shower, or whatever. There's a million different things. I always like to. A lot of couples have fun with a lunch sex date,
Right, right.
but not. We're programmed to think I lay down to go to sleep. This is when people have sex. But even in the movies, folks, is that what you're seeing? A lot of times that's not what's happening. They're in the kitchen on the table, they're up against the wall, they're in the shower. I think that's a really important thing because as a person, all transparency here, who falls asleep about the minute my head hits the pillow, my wife laughs. She's like, yeah, you're out before your head hits the pillow.
Yeah.
You gotta be
It's not optimal. It's not optimal for blood flow. It's not optimal for gastric distress and having your bladder full. If your tummy's full from dinner, oh God, no, 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 no. I don't want to be naked then. Absolutely not. In the morning, you're all thin. And you got guys have much better erections in the morning, if I'm not mistaken. And
yeah.
also the noise of the day isn't going. So you're not thinking, oh my God, I got to put the washer into the dryer and I've got to get to the grocery store. You're not there. If it's nice and early in the morning, often the noise hasn't started yet. It's a quiet, lovely time. Also, teenage kids aren't up yet. Definitely not up yet. So for my patients who say, oh, I can't have sex when the kids are home, I just can't do that. I promise you they're sound asleep at 6 in the morning or 5:30 or 7:10 in the morning. So yeah,
And
how
this,
about this one? Go ahead. Go ahead.
no, I was just thinking because you talked a little bit about it. We found when our kids were really little, the shower was our best friend. It's
Hmm.
like you could be in the bathroom in the shower when they're younger and stuff. And it's like you had a little bit of privacy, and that was a way, like you said. So you got to be a little creative when the kiddos are around. And two, Suze, sometimes that happens later in life. They left and they're back, and then now
Yes,
you're
I
like,
know.
how do we have sex now?
Now they're back with their boyfriend or their husband or or your grandchildren. You're like, oh my God, no, 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 no. But you can still make time. Which reminds me, when we talk about making time, there's a really special role for scheduling sex. I can't tell you how often we both hear, oh my gosh, it's not spontaneous. We can't, scheduling sex is so gross. Yeah, no, it's not. Number one, sex gets taken care of when you schedule sex. Number two, for both men and women, sometimes there's preemptive stuff that has to happen, like I have to take a Viagra, or like I want to brush my teeth. The very least is brush your teeth, for God's sake. Okay. The other thing is maybe you need to put some vaginal cream on for moisture or use a lube. Things have to have, it's not just like, wow, it's the magic happens as magic over the years. It's important to prep and be present and present yourself for your partner. So that takes some forethought. In having said that, then if it takes forethought, then that's not spontaneous, is it? And if it's scheduled, it'll happen. You don't just get to your kid's soccer game, you schedule and you go to that soccer game, right? So what's wrong with scheduling sex? And that's a huge take home that I think I would like our listeners to hear. And I have to remind myself of that all the time.
And there all kinds of spontaneity can happen around it. Where are you going to have sex? Nobody said you could have it anywhere in the house or out of the house, at 7 o'clock when you thought you would. Or if you say we have sex on Tuesday nights, well, maybe you will at 7, 8. You can add spontaneity into it, but
Right.
put it in your schedule. Put it in.
Absolutely. The other thing is remember when you talked a minute ago about desire discrepancies, maybe let's do it, we'll turn it around. The woman has more desire than the man, let's say. If sex is like, quote, on the mental or physical calendar, the anxiety of the higher sex desire person, they're not like, oh, I'm starving here. When am I ever going to have sex again? They know when they're going to have sex again because it's scheduled, and to be very frank, sometimes the lower sex person, because it's scheduled, when it's over, she's like, well, there we go. That's done for a week. And so
Mhm.
at the end of the day, it's the unwritten part of sexual play that causes insane amounts of anxiety. So
Oh,
scheduling really quiets that down, really quiets that down.
and I have so many long-term couples that how they stay sexual is we have sex every Sunday, whether we need it or not. It happens every Sunday. I'm like, that's awesome. So
Yeah.
that's how you get it done. You're once or twice or three times, well, however many times a week you've worked on together by putting it in your schedule. I think it's a really huge deal, and I think it can be a wonderful, wonderful thing because what happens is life gets in the way and it never gets done when you try to just be spontaneous all the time with it and
Mhm.
everything. So
You're right. And then when it doesn't happen, anxiety raises. Somebody's going to get anxious when that happens.
and then too, I love how you talk about because we all have these sexual scripts. I touch you here, I do this, that's sort of our indications. But then too, we have that person who is feeling like maybe they don't want to be as sexual. And so then they're like, well, I don't want to really come up and grab the back of your and give you a touch on the back of your back because you might think I want sex and I don't.
Mhm.
I just want to be
Mhm.
affectionate. So
Mhm.
it releases some of that angst when it's like, what does that mean? If I touch you or I roll over towards you, oh, I know what that means. And now it's like, okay, then can't we just do that and it not mean anything more than I want to roll over and be body to body with you or have a really amazing spooning cuddle or something? So these things are really important, especially when there's a desire discrepancy, which you were talking about. And there's almost always a desire discrepancy. We are
Mhm.
all different, you
That's
know?
right. It's right. Even
And
if you
one
start
may
the relationship on the same page, both really, really horny in the beginning, but over time, there's going to be, and sometimes in your second decade or third decade, the desire goes the other way. Like she's pregnant and he's working really hard, and he's feeling going to the cardiologist and not feeling really great about his overall health, or he's worried about his health, and she's thinking, oh, let's get busy here. And so desire discrepancies can happen either way, and they change all through a relationship. So it's learning to navigate those.
And so too, because everybody thinks it's always spontaneous. There's always spontaneous desire. We have this hormonal driven, just I gotta have it, I need it. And that does happen sometimes. But when they did research, they found, up to about a third or more of women, and sometimes a third of men don't, especially as they age, don't have spontaneous desire. They have what we've called in the program before and what you hear us refer to as
Mhm.
responsive desire. Rosemary Bassan, I look at her study, and she's also a person who looked at this desire discrepancy and desire problem things. And she created an incredible model we've shown before. But when she went to do her research, she said it all starts with desire. That's what Masters and Johnson said. This is a researcher's nightmare. A third of those women said, no, it doesn't start with that because they had responsive desire. So, talk a little bit about how responsive desire is different and it's very common and prevalent, especially in long term relationships.
Absolutely. I'm going to take it back to my patients because that's where I learn so much from them all the time. So they'll say, okay, let's say I put this sex on the calendar, Dr. Kellogg, like you asked me to. And so it's going to be Sunday morning is very popular, by the way. So Sunday morning at like, I don't know, 8 o'clock in the morning, let's say. And then the patient will say to me, but Dr. Kellogg, I don't wake up desirous in on Sunday morning. Does that mean they shouldn't try to have sex? Well, not really. And so I will say to them, so let's say that you begin to play with your partner and just smooching and cuddling and things like that. You relax into the moment. Do you sometimes get in the mood when things are underway, so to speak, after maybe you're kissing or stroking, or maybe even, like oral sex has already started or manual sex has already started. And then finally you're on the love train, like you get with it. And that getting with it is called responsive desire. It's like, oh, this is nice. I forgot how good this feels. I'm glad I'm here. We should do this more often. That's responsive desire. You can go into a scenario not feeling desire, and mid scenario, oh my goodness, light bulbs go off. I hate to tell you this, same thing happens with me at the gym. I hate going to the gym, but when I get there and I'm working out and I'm feeling strong and I'm just feeling amazing, I'm like, I'm so glad I'm here. I should do this more often. There's so many things in life, right?
That's exactly what so many patients tell me about sex. They're like, I kind of forget about it and I'm not. And then when I'm doing, I'm like, I need to do this more. This is awesome. It's great. That's a perfect description of what I hear from so many patients. Because I always say, but when you're having sex, do you enjoy it? Oh yeah. And they're like, and
Mhm.
often I think, why don't I do this more? This is so nice. That's responsive desire. But it might even start with, so what do they say? What does Bassan and all of them kind of say it starts with? Connection. It just
Yep.
starts with the connection. So it may
Yep.
start in the kitchen and you're like talking or cooking together and you're like, I feel incredibly connected to you. Then you start kissing or touching and it comes out of all that. It unfolds. That's
Right.
responsive desire.
Also, sex doesn't have to be intercourse. Newsflash. Sex can be like literally, you don't even have to be naked half the time to have sex. You can just be sexually connected. Like, I love you, babe. I love you back, babe. Do you know? And like that
Mhm.
kind of that is a sexual interplay. Do you know? It really is.
Absolutely.
Sometimes when couples are having what they call sex, it's a one-way street and it's absolutely consensual. The woman, for whatever reason, maybe she's having menstrual cramps, whatever, and she just wants to pleasure her partner and not necessarily be pleasured herself, or vice versa. That's
Definitely.
absolutely acceptable as well. It's that connection and coming together that really is what we're striving after. Because if it's just about orgasm, we can do that ourselves. Thank you very much. It's not just about that, it's about connection.
So, so true. It's about that deep connection for most people. And so people say, well, we'll talk about how women have a tenth of the testosterone men do and less after menopause. And so he's like, but it seems like she wants to be with me. She desires. And I say, she wants you. She wants to be connected to you. And I remind them too, your penis doesn't make or break her love for you or her need for connection to you. So if you don't get hard, she still wants to be with you. She still wants
Yep.
to have fun and play. And you don't have to
Yeah.
have intercourse to play. You don't have to have
Exactly.
intercourse to have sex. You can have,
Exactly.
we did a whole
Convert
episode on that.
Conversely, if a woman, let's say a postmenopausal woman who has dryness, if she's having dryness, she doesn't have to be completely wet to have sex. She will love that cuddle and love that kissing, and maybe she'll get moist and maybe she won't. Maybe she'll use lube and maybe she won't. It doesn't matter. It's really that connection that's important. So,
it,
yeah.
it's such a big deal. So different people have different desires. That's totally normal. You may have a different desire this week versus next week. Your partner may have more
Yep.
desire tomorrow than you do. It can change. But I think that just kind of learning to find a way through to connect. And so maybe what your partner wants from you, you kind of work on. Well, how often, I'd like to be sexual more. Well, what does that mean? And you talk through it. The more you
Mm-hmm.
talk about it, the more comfortable you get at navigating and figuring that out for your relationship. So yes, discrepancies are common. And so you think, well, gosh, what does that do for the person? Well, the higher desire partner, you think, well, what's their deal? I mean, they're just horny. No, they experience rejection. They feel lonely and frustrated. And
Right.
that's why you got to talk about it. And then the
Mm-hmm.
lower desire partner sometimes feels pressured, guilted, feelings of that they're inadequate or broken or something's wrong with them. But you are beautifully made, listener. You are whole and you are more than enough and you are not broken. You have issues, but you are not broken. So you work it out. You work it out like we all do. And you go through phases. After 40 years, both of us in our relationships, there's times where you're more sexual. There's times where you're less sexual. And if somebody's feeling left out or upset, whether they're high or low desire, talk about it.
Yeah,
Talk.
absolutely. Before we go on, I would really like to talk about, we've done a lot of the whole psychology of this, which is very, very important. But guess what? Science has come through for men and women, and there are adjunct medications and supplements that help with desire. Jeff, there's so many things for men. Can you go over those? And I'll do the women ones.
Well, see, here's the truth. You got a whole lot more things for desire for women than men have for desire. For men, most of the time it ends up in one bucket. And this is where sometimes men wrongly think, because desire is not always about hormones. In fact, many of the patients who have desire or libido discrepancies, the men, they don't have low T necessarily.
Mm-hmm. Mm-hmm.
Now, if you have low T and you have low desire and erectile other symptoms of low T, that's called hypogonadism, which means you have several of these symptoms and you have low testosterone levels. So men throw it in that bucket. In fact, even if they have erectile dysfunction, which testosterone has a very small role in, they'll come in and say, I think my T is low because I did a whole talk on this once. I think my T is low because I have erectile dysfunction. That is not the reason men have erectile dysfunction. That's 5% or less of men. So testosterone has been approved for men. And thank God we even have a pill now. And we've done plenty of episodes on it. So you can go back and watch those. The classic way was injections, but there's the topical, there's the new pill. There's a buccal that goes inside here. There's different topical mixtures as well. Lots of testosterone things for the appropriate person. Testosterone is a controlled substance, so it has to be given by prescription by a prescriber who has a DEA and can prescribe controlled substances. Um, for the right person, it can be a wonderful thing. For some people with all the symptoms of hypogonadism, I've had patients who had them all. It does nothing sometimes. So, what we have to see, is it the culprit? That probably answers a lot. And do you really have low T? Well, some men are like, more is better. More causes a lot of problems with testosterone, and most drugs, even vitamins, can cause cancer when you
Yep.
overdo it. So be really careful of that. So that's the only thing I can really talk about with desire for men, because we don't really have anything else that has been FDA approved or looked at for men with desire. Some men do use some supplements like Korean red ginseng and things, and find that that can be helpful, and some studies show it may be, but really not a ton of certainly prescription things, nothing besides the testosterone for men. How about women?
Oh, we have all kinds of things, but it's been long in coming. Oh my goodness, for many, many, many years, all women had was lubricants. No lie. That was it. Just, either water-based lubricants or oil-based lubricants or silicone-based lubricants to make things more comfortable. But as of 2015, the very first drug was FDA approved for low desire in women. It's called Addyi or flibanserin, and it was approved, but only approved for premenopausal women based on the studies. The studies showed that about 60% of people who took this particular drug responded by having increased responsive desire and initiative desire. And so they felt good about that. But unfortunately, the FDA didn't see fit to approve it for postmenopausal women, which is a little frustrating because postmenopausal women really wanted it the most. So back in 2015, flibanserin or Addyi was FDA approved for women for low desire premenopausal. Now, in December,
Mm.
finally, of
Yay!
2025, I know, this was approved for postmenopausal women, but they still put the caveat on under the age of 65. So women had, because God forbid anybody over 65 wants to have sex, God forbid. Anyway, so sorry, that's my sarcastic self. So the FDA has approved the drug flibanserin for pre and postmenopausal women under the age of 65 with low desire with distress. And it's important that the patient is having distress, and it's not her partner that's having distress, it's she herself that's having distress. Also, by the way, Addyi is a pill that a woman takes every single night. There's about 60% of women who take it are responders, and actually it helps their desire. And about 40% of women who take it, they take it and they do fine with it because the side effect profile is very low, but they don't feel any desire. So that's called a non-responder. The one thing we need to know about Addyi is that we shouldn't mix it with high levels of alcohol. In fact, most women should decrease the amount of alcohol they have 2 hours before they ingest Addyi. And if they've had, like, let's say they're at a wedding and you're partying all night and having multiple glasses of whatever, that's a night that Addyi shouldn't be taken. It should not be mixed with alcohol directly. Also, if one takes Addie at night and then decides to have a glass of wine afterwards, no, that's a no too. So it's separated from 2 hours from the last glass of something, and after it's ingested, no more glasses of anything but water. Okay.
And that's
That's just a
interesting
caveat.
too. I was going to say too, what's so cool about that drug is testosterone's a hormonal thing. This is not a hormonal medication. It works in the brain, right?
It does. It works with neurotransmitters, dopamine, norepinephrine,
So cool.
and serotonin. It's great, but it's not an SSRI either. It's not like a psychology depression drug. It's literally for low desire in women, which makes it so cool. Now, if a woman, let's say that a woman didn't want to, she really loved the idea, but she didn't want to take a pill every single day. She said, isn't there something, guys get to take a Viagra and an hour later they're ready to rock and roll. So is there anything like that for women? Yeah, there is actually. There is an auto injector, like an EpiPen that a woman can inject herself with called Vyleesi. Excuse me. This drug increases desire. It also in the brain. It is non-hormonal, also making it a wonderful drug. That has been FDA approved for premenopausal women as well. So we'll see what happens with the postmenopausal approval. I would imagine it will be coming soon, I hope. But it can be prescribed what they call off-label for women who are postmenopausal right now. The one thing about Vyleesi is that it's a lovely idea because it can be used on demand, so to speak, but it does have a side effect profile that includes some nausea for some women. And so it's very important that if a woman feels that while she's on that EpiPen, she should talk to her provider about getting a pill to decrease nausea while she's on it. And that could be taken, an hour before or something like that. We also have testosterone for women. That is considered off-label, not FDA approved. But we still suggest that a woman, if she's going to use testosterone, she do so under very careful guidance of her provider, and that if a little is good, a lot isn't necessarily more, because there could be a side effects that include some hair growth, some acne, and some voice changes as well. And so there's also a metabolic pathway between testosterone and estrogen, and that should be taken into account when a woman is on testosterone. But at least it's an option. It's absolutely an option. That obviously is a hormonal option, and the previously two things we talked about are non-hormonal options for women.
It's so exciting that we have all that now. Isn't that amazing? I mean,
It's
we finally
great.
come into it. And so now women have a little bit more than men with the desire side, which is great.
I know.
And same thing, so just because the FDA is more stringent. Testosterone was approved for men decades ago when they were not so tough. And that's the reason why it didn't get through the FDA, even though there are wonderful studies with women using testosterone. There are excellent studies, but regardless, don't get testosterone from anybody else or anywhere else except a really good provider who knows how to watch really important things. Because you'll hear about why. Because you'll hear about, oh my gosh, you're watching the football game and it'll say, do you have low T? Everybody, this is really important. You need to address it. And then a few minutes later, you'll say, if you took testosterone and would like to sue your doctor because you had a cardiovascular event, you have to do these things under supervision with a good clinician who knows how to monitor your blood levels and all the things we monitor when you're on testosterone. It can be absolutely done safely for the right patient and the right person. And sometimes it can be helpful for those people, but it has to be done under supervision.
Absolutely. And that's true. I mean, that's true of any medicine, but sometimes, in our thirst for desire, sometimes there's kind of some people that start women on lots of drugs, but particularly hormones, and then they don't watch them. They just, especially, I have nothing against telemedicine, but sometimes some of those call-in places, they don't even get a physical examination. And so just be smart about it. That's all I'm going to say to the listeners. Please be smart about any kind of hormonal ingestion. And that's whether you're a man or a woman. For sure.
Think about what you're putting in your body, whatever it is. I've seen people end up in the ER from things they took from a gas station bathroom.
Yeah.
Think about, it's natural. If you walk in the woods and you eat certain things, they can kill you. Think about what you're putting in your body, and do you trust the source and what it's coming from? So always be careful with all treatments, but it's so exciting because we have lots of different treatments now, which is awesome.
Absolutely. Absolutely.
Oh,
I think this whole topic of desire is so fascinating because we want it so badly, but then people are not in the mood. It's kind of a dichotomy, but I think our take-home message, at least for me from this session, has been to really think about why you don't have desire, but don't expect it to just come out magically out of the clouds. You have to, it's something you work on. It's the same way you work on, being happy. Happiness doesn't come out of the clouds either. It's something that we work on and we strive for, and we do things that we know lead to better desire and better happiness.
definitely. Well, I'm going to do my closing exercise and I'll come back to you for more of those final thoughts. We'll talk together about we could talk about low desire all night. We really are going to have to do another episode. We've got some coming up that are focused on desire, but we'll do more on it. But great discussion. Okay, so as we close today's conversation, as we start towards closing, I invite you to take a moment just for yourself. If you're comfortable, rest your hands gently, put your feet flat on the floor, get in a comfortable position. If you want to put your hand on your heart or your abdomen or rest them on your lap, whatever feels comfortable to you. Allow your shoulders to soften, unclench any tension you feel in your back, neck, jaw. Notice the surface beneath you supporting your body. Take a slow breath in your nose for about 4 counts. And gently exhale 5 counts. Again, breathe in slowly in your nose and breathe out fully through your mouth. Continue the breathing pattern in your nose and out your mouth, slow and gentle. As you breathe, remind yourself, desire is not a measure of worth. Desire is not a measure of worth. Intimacy begins with compassion and understanding. Intimacy begins with compassion and understanding. My needs, my feelings, and my experiences matter. My needs, my feelings, and my experiences matter. Allow your pelvic floor to soften. Let go of any pressure to perform, fix, or force anything right now. Just relax. Simply notice what your body and your heart may be asking for. What are they asking for? Rest, connection, honesty, tenderness, patience. What is your body and heart and soul asking for? Remember, you are inherently worthy of love, connection, and intimacy exactly as you are. You are enough and you are worthy of love. Remember, as we move forward, that intimacy thrives when couples replace blame and assumptions with curiosity, with compassion, and with collaboration. Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
In this enlightening episode, we welcome integrative psychiatrist and sexual medicine expert Barbara Bartlick to explore some innovative approaches to sexual health and intimacy. Moving beyond a purely biomedical model, Dr. Bartlick shares evidence-based complementary approaches for treating sexual dysfunction. Dr. Bartlick also offers practical insights into how patients and couples can take a more active, empowered role in their sexual health journey. Join us on June 9th at 7 p.m. Central Time to learn more.
And Janet Mendez will be there too, both of which were the editors of a sexual medicine book that we wrote chapters for. It's an Andrew Weil book, and they're turning it into a book soon for patients. The first one was directed at clinicians. The next one's going to be directed at patients, and they'll be joining me, both of them, next week. That'll be an exciting episode. But gosh, low desire is such an important thing. And I hope that we have, I know both of our greatest hope is that people know you're not broken, you're not abnormal because you don't have this killer robust desire. If you have a killer robust desire, you're not broken or abnormal. Whatever it is for you, it's your normal, and it's good. So as we finish up, you already kind of gave us some final thoughts. Any last sentence you'd like to leave our listeners with, Suze?
Yeah, sometimes, with or without desire, reaching out for your partner and loving your partner in an intimate way can show the goodwill that is so inherent in marriage. My husband shows me goodwill all the time when he gets up early and takes the stupid garbage out. I can't stand that. I don't like to do that. And he shows goodwill. Do you think he has desire to take the garbage out? He does not. I know he does. Neither do I. But so it isn't desire. It's his wanting to show me goodwill in marriage, to show equal partnership, to show he's doing a nice thing for me. And sometimes being in an intimate space with your partner shows them goodwill, even if you're not just dying for intimacy in a physical way yourself. So think about that too, is showing the goodwill that is so important to keep a marriage going or to keep a relationship going.
I love that. I agree. I think every choice you make affects your partner. So make wise choices for sure.
Yeah, exactly.
And even the most basic choices, like you finished going to the bathroom. Where's the lid of the toilet when you finish? It all matters, right?
Yeah, absolutely. Absolutely.
So I think speaking love and purposefully putting love and intimacy into your relationship, you can never go wrong with that, right?
Absolutely.
And so listener, I hope you speak more love, more connection. Who doesn't want more of that into your relationship? Gosh, Suze, thank you so much. I love you dearly, and you and your husband both, and I'm so happy to have you on regularly. Thank you for being such a big part of Dr. Jeff Talks About Sex and Intimacy.
My pleasure. Good night, everyone.
Who's Dr. Jeff Talks About Sex and Intimacy, breaking down the science, setting your spirit free with stories, wisdom, laughter, and care. Connection